Greetings, this is Dr. Doyle, and you are viewing Module 2 entitled, What is a Toxic Agent? In this module, we are continuing the introduction to toxicology that we started in the first module. The term, toxic agent, is a very general term for something that can cause toxicity. Therefore, this could include a chemical, such as a drug or industrial solvent, or a non-chemical agent, such as ultraviolet light. The material that is included in this module does not exactly correlate with any of the assigned readings, but toxic agents are described in the beginning of Chapter 2 and in Chapters 22 through 27 of the textbook. I will be discussing various toxic agents throughout the course. For example, I talked about conine, a plant-derived alkaloid toxin, in the previous module. Finally, this module will also provide an overview of the processes of absorption, distribution, metabolism, and drug interactions for a toxic agent, which we will cover in detail during the first half of this course. I like chocolate, as do many people. I know that I should not eat a lot of it because it usually is in foods that contain a large number of calories. But can something as good tasting as chocolate be toxic? Well, it depends on who is eating it. For most humans, chocolate is not toxic because we are able to readily metabolize and eliminate the ingredient compounds of chocolate. However, some animals, such as dogs and cats, are unable to metabolize theobromine, another plant alkaloid. The difference here between these animals and us is that we have much greater activities of cytochrome P450-1A2 and 2E1, which are key enzymes for the detoxification of theobromine. We will be talking much more about these and other enzymes that can either decrease or increase the toxicity of a chemical in modules 7 through 15. So, we can see from this example that toxicity is not only related to the toxic agent, but also to host factors such as metabolism. Of course, chocolate toxicity is also related to how much is ingested. If a dog were to eat a single Hershey's milk chocolate kiss weighing about 5 grams and containing only 5 milligrams of theobromine, it would probably not have any toxic symptoms. Whereas, if the same dog were to eat an 8-ounce package of Baker's dark chocolate containing approximately 2,200 milligrams of theobromine, it would certainly receive a toxic dose and may develop seizure activity because of blockade of inhibitory adenosine A1 receptors in the central nervous system. We will be learning much more about neurotoxicity in modules 34 through 36. There are many ways that toxic agents can be classified. Different means of classification are suitable for different toxicology purposes. Examples of physical characteristics are classification according to whether the toxic agent is a gas, liquid, or solid. Toxic agents are often classified on the basis of their potency, such as extremely, very, or slightly toxic. A useful classification is based on chemical structure such as molecular polarity, or more specifically, aromatic amines, halogenated hydrocarbons, aryl nitrates, acyl glucuronides, and so on. Risk management systems often classify toxic agents on the basis of a health hazard, such as irritant, corrosive, oxidizer, explosive, or combustive. Also included in this classification would be the potential to cause cancer. we will talk in more detail about chemical carcinogenesis in modules 22 through 24. A very informative method of classification is on the basis of toxic agent mechanism of action. These mechanisms include alkylating agents, cholinesterase inhibitors, methemoglobin producers, and others that will be discussed throughout the course. Toxicologists often refer to toxic agents in terms of their major organ of toxicity, such as those causing toxicity to the fetus, reproductive organs, liver, kidney, and nervous system. Modules in the second half of the semester will specifically cover toxicity of organ systems. Another type of classification is based on the source of the toxic agent. For example, toxins derived from plants, fungi, and bacteria, venoms derived from invertebrate and vertebrate animals, and industrial-derived pollutants. A very common classification for some types of toxic agents is based on their use. For example, pesticides, herbicides, drugs, food additives, and solvents. The term toxic agent is the most inclusive term for something that causes toxicity. Toxic agents can be further grouped as xenobiotics, which are chemicals to which the body is exposed that are not part of the normal metabolic processes of that organism. For example, mercury is a xenobiotic metal because it serves no purpose in human metabolic processes, whereas iron is an endobiotic metal because it has a physiological function of carrying oxygen in the body. However, it should be noted that iron can be toxic if body levels exceed normal limits, resulting in unbound iron, which may cause toxic oxygen-free radicals to form, as will be described in Module 18. The xenobiotics can be further subdivided into toxicants, which are man-made materials, metals, and toxins, which are biologically derived but are foreign to the human body. Another term that I am sure you have frequently encountered is poison. A poison is best defined as a xenobiotic that causes immediate severe disability or death. A toxic agent which is not a xenobiotic are the various types of ionizing radiation, such as ultraviolet light, beta or gamma irradiation. Although radiation toxicology is an important field, the focus of this course will be on toxicity due to xenobiotics, especially drugs. The effect of a xenobiotic on the body will be determined by two factors, which are the toxicokinetics and toxicodynamics of the chemical. Toxicokinetics is a combination of the rate of absorption, metabolism, and elimination of the xenobiotic. Therefore, it can be simply stated as what the body does to a xenobiotic. Toxicodynamics is the interaction of the xenobiotic with chemicals in the body, especially the molecular target of toxicity. So this can be restated as what a xenobiotic does to the body. Although a xenobiotic usually has multiple potential targets of toxicity, we are usually only interested in the ones that interact with the lowest concentration, which would also be the target with the greatest affinity, or targets that interact most rapidly and therefore lead to acute toxicity. Toxicity can vary since both of these factors can be varied. For example, if a toxicant is detoxified by metabolic processes, then if these processes are inhibited, there would be a greater systemic concentration of the toxicant and hence greater toxicity. If the toxicant were instead activated by metabolic processes, then the concentration of the ultimate toxicant and hence of toxicity would be diminished. These topics will be further explored in modules 3 through 21. The diagram shows the movement of a toxicant into, through, and out of the body. We will examine specific parts of this pathway in the next several modules. Routes of toxic exposure can include oral, cutaneous, respiratory, or parenteral. Total exposure is the product of several factors, including concentration of the toxic agent at the absorptive surface, the time duration of the exposure, and the exposed area of the body surface. Physiological factors are also dependent upon the route of exposure. For oral exposure, such as in the jejunum lunum shown here, the rate of gastric emptying and intestinal peristalsis would be a factor. For inhalation exposure, the respiratory rate would be a factor. For cutaneous exposure, changes in dermal blood flow with body temperature may be a factor. Absorption is the first step in the process whereby a xenobiotic gains access to the body. The site of exposure, where absorption occurs, would be the first tissue barrier that the xenobiotic must traverse before it finally encounters the target. Generally, nonpolar hydrophobic molecules are the more potent toxicants because they can more readily diffuse through nonpolar membranes that separate the extracellular and intracellular compartments between the site of exposure and the target. Properties of the absorptive surface can also be important. For example, cutaneous absorption of most xenobiotics is lower in the palms of the hands and soles of the feet than in the skin from other regions because the impermeable stratum corneum is thicker in these areas. Transport of the xenobiotic through the absorptive tissue barrier is most often a passive diffusion process. Hence, nonpolar xenobiotics most readily diffuse across the nonpolar lipid bilayer membranes of the absorptive surface, as long as an adequate concentration gradient exists. Absorption of polar xenobiotics can be enhanced by facilitated or active transporters within the cell membranes of the absorptive tissues. If you would like to review the mechanisms of transport across phospholipid bilayer membranes, please open the transport link located in the Module 2 folder. The topics of xenobiotic absorption and distribution will be described in greater detail in Modules 4 through 6. The distribution of toxicants is regulated by the same kinetic properties as for therapeutics. This means that the xenobiotic is distributed throughout the body via a central compartment, which would be the blood plasma. The amount of xenobiotic entering the plasma compartment is often decreased by pre-systemic elimination, also called first-pass metabolism by the liver. Since most xenobiotics are hydrophobic nonpolar chemicals, their transport in the plasma is enhanced by protein binding, usually to albumin. Toxicity is proportional to the interaction of unbound xenobiotic with molecular targets. Hence, toxicity may be diminished by strong protein binding or by sequestration into storage sites, such as fat or bone tissue. Movement of the xenobiotic from the central plasma compartment to other compartments, such as target tissues, is determined by the transport rate across the membrane barrier of that compartment. As was discussed in the previous slide, transport is provided by passive diffusion of nonpolar molecules, facilitated or active transport of polar molecules, and also by the movement through spaces between adjacent capillary endothelial cells. This last factor is called capillary porosity, and it varies greatly in the circulatory system, from being minimal in capillaries forming the blood-brain barrier to being very leaky, such as in the sinusoidal spaces of the liver. Membrane transporters are not only important in bringing polar molecules into a tissue compartment, but also in exporting toxic nonpolar molecules from a target tissue back into the plasma against a concentration gradient. Concentration of a xenobiotic in a target organ can sometimes occur by organelle trapping. For example, an organic base can passively diffuse into a lysosome because it is in its protonated, nonpolar form, and then encounters the acidic pH of the lysosome, where it is ionized into its polar form, which is unable to fuse back out of the lysosome. These are just a few examples of the processes that control the distribution of xenobiotics in the body. This material will be covered in greater detail in modules 4 through 6. Whereas absorption of a xenobiotic is favored by lipid solubility, transport of the molecule in the blood and elimination by the kidney is greater if the molecule is converted into a water-soluble form. This metabolic process usually occurs in the liver, especially following oral exposure, when the xenobiotic is initially transported from the intestinal capillaries to the liver by the hepatic portal vein. Depending upon the structure of the xenobiotic, various enzyme reactions including hydrolysis, reduction, oxidation, and conjugation can occur, usually yielding a more polar water-soluble metabolite. An example is shown here where toluene is oxidized by a number of hepatic cytochrome P450 enzymes, especially cytochrome P2E1. This process usually results in reducing the potential toxicity of a xenobiotic by decreasing its half-life and possibly by modifying reactive groups. Occasionally, metabolism has the opposite effect and results in bioactivation, creating the ultimate toxic species. The effect of metabolism on xenobiotic-induced toxicity will be described in greater detail in modules 7 through 15. Reabsorption can play an important part in the mechanism of toxicity to the liver or kidneys for some xenobiotics. Many xenobiotic metabolites are eliminated in the bile as glucuronide conjugates. These enter the duodenum and can be eliminated in the feces. However, some are reabsorbed in the jejunum or ileum and can be returned to the liver via the hepatic portal vein. This results in an increased half-life of the xenobiotic and increased exposure of hepatocytes to the xenobiotic, sometimes causing hepatotoxicity. Nonpolar xenobiotics also have the potential for reabsorption in the proximal convoluted tubules of the kidney. Toxicodynamics is the interaction of xenobiotics with molecular targets that result in injury. These interactions can occur at the site of exposure if the xenobiotic initially has reactivity to a target in this tissue. More often, the parent xenobiotic molecule must undergo some change to yield a reactive metabolite. The tissue where this metabolism occurs is usually where toxicity is observed. That is why toxicity is often observed in the liver because of its high metabolic activity and early exposure to absorbed xenobiotics. Examples of interactions of the reactive toxic molecule with its target are shown here and will be further discussed in this course, especially in modules 17 through 21. This completes Module 2. Please test your knowledge of this material by taking the self-assessment quiz.